medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Leading causes of death in the United States as well as in the world remain as heart disease number 1 and cancer number 2. Hi, I'm Dr. Mitch Ghen. These are followed by other diseases, chronic vascular disease, basically stroke, chronic lower respiratory infection, and even Alzheimer's. And often not cited, but it is true that properly prescribed medications add into this formula as well. When it comes to life expectancy, the United States ranks lower compared to many other developed countries. And according to the World Health Organization, the life expectancy in the United States is around 79 years, which is lower than countries like Japan, Switzerland, and Australia, where life expectancy is over 80 years. In recent years, there has been a concerning trend of a slight decrease in life expectancy right here in the U.S. Factors that said to contribute to this decline include the opioid crisis, increasing rates of obesity and related health issues, lack of access to health care for some populations, and quality of health care issues. I believe there are several other major issues that come into the decrease in life expectancy as well, often not spoken about. So how are we as healthcare practitioners, how do we improve these stats for our patients? Well, here's my take. In several different areas, I look at all these in my patients by a deep dive into blood tests, etc., to determine these and then do something about them. For example, we need to discover chronic inflammation and do something about it. We know it's the nidus for so many different diseases. It doesn't make sense for us not to look for it appropriately and, of course, address it appropriately. Keep, if possible, hormone levels at youthful levels. If it's possible, of course. It's no question that we feel better when we're 25 to 35 than we do when we're 75 to 85. Develop a nutritional program to improve whatever gaps you may find, and that, of course, would also be found by a deep dive into a comprehensive blood panel, and a program that will maintain optimal levels for your patients. And consider the fact that the mind-body connection is as important as everything else that you do that we just talked about. As a PhD in psychoneuroimmunology, you can't imagine what you think is what you create. If you feel you're doing good, no matter what, you often do quite well. Quite the opposite as well, too. And don't do detoxification programs when you don't have a clue what you're detoxing. If there's something identified in your workup, i.e. a toxic metal, for example, then of course, take the proper measures to remove it. And most importantly, which I always suggest, is don't belong to any dogma club. They don't allow you to see other potential modalities or processes that can prolong the quality of your patients' lives. For more information, please contact me at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching.